The philosophy that I like to initially embrace in this concept is, in a disease that is frankly not yet curable, although there may be a small fraction of patients that we effectively cure, we want as many options as possible. And the benefit of these new drugs, in particular the monoclonal antibodies, is providing us a completely different mechanism so that the ideal sequence is not yet determined, but having those options are going to be of value. I think in the very short term, we're going to see drugs like Elotuzumab used a little bit earlier on in the relapse setting, whereas Daratumumab, approved for beyond third line therapy, will be more extensively used later on. But I think what we're almost definitely going to see before too long is the anti-CD38 molecules coming up front earlier, even in frontline therapy and using in combination. So I sometimes describe a fourfold skeleton, if you will, or fourfold base of proteasome inhibitors, immune modulatory drugs, monoclonal antibodies, and more standard historical alkylating agents. And I think almost every myeloma patient, be it transplant eligible or not, is going to have some kind of strategy that incorporates those 4 drugs within the patient's initial therapy and first, if not second, relapse. And then the shuffling will come based on how well they responded to one class versus another, how well they tolerated one class versus another. And it's led now to almost innumerable combinations and permutations of these drugs. But I would look at it with a lot of hope. I'm very thankful that not only do we have new mechanisms of action, but drugs like ixazomib that are more conveniently delivered and taken with fewer side effects, which I think will also affect our ability to treat an older or more frail population in a more effective and less toxic way. So that's a long-winded way of not giving you a precise answer, but to say that it's wonderful to have these options. I would rather have this than have what we had not that long ago, where we had very few cards in the deck to play. More and more cards simply means more options for our patients and almost definitely prolonged survival.